Okay, well, thanks everyone for joining. It's my pleasure to co-host this with our collaborative specialization in global health representative, PhD representative, Alyssa Kelly. I'm going to get us started and then turn things over to Alyssa after we hear from a few of our panelists. We want to keep this quite informal, and so and also hear from you, because I'm sure there's a lot of wisdom in the Zoom room, virtual room, with this in terms of considering how you're having to pivot your research in light of COVID. And so we do invite you to share your perspectives and or direct any questions you have towards the panelists. So just before we get started, I wanted to take an opportunity to acknowledge the land upon which the University of Toronto operates. For thousands of years, it's been the traditional land of the Huron-Wendat, the Seneca, and most recently, the Mississaugas of the Credit River. Today, this meeting place is still the home to many Indigenous peoples from across Turtle Island, and we are very grateful to have the opportunity to work on this land. We're delighted to have 5 students who have agreed to share their experiences, I guess the good, the bad, and the ugly. And we've actually suggested that they speak in a certain order based on sort of the stage of research they're at. So I'm going to introduce them all at once and then invite each of them to provide some commentary from their perspective, about 5 minutes each, and then we'll have a lot of time for questions. So the first person up is Shameen Ahmad, who is a social and behavioral health sciences PhD candidate at the Delana School of Public Health. And he'll be speaking sort of from the perspective of a student researcher who is more at the research design, trying to get his ethics protocol approval stage. Then James White will follow. James is a student, PhD student in nursing, and will also sort of speak from roughly that perspective around the REB protocol stage. Then we're going to have perspectives from 2 other students, Arlinda Rucco, who's a PhD candidate at the Institute of Health Policy Management and Evaluation, who will reflect a bit on her research and in particular, her experience with running focus groups virtually. And she'll be followed by Sarisha Bobali from also from Social and Behavioral Health Sciences stream at the Delana School of Public Health. Who will speak a bit about the virtual interviews that she's had to conduct with key decision makers in Guyana. And finally, Alison Daniel, who is a PhD candidate also in the Global Health stream in nutritional sciences, who will talk about how she's had to pivot her research, not just because of COVID, but for other reasons, which I'll let her reveal, because she's more at the analysis stage. So we're really fortunate to have all 5 of you here to kick this discussion off. And I will invite Shameen to get started. And you have about 5 minutes. If it's all right with everyone, we will take all 5 presentations together. And then, but you can start putting your questions in the chat or comments. We want this to be very interactive. And I'll hand things over to Alyssa to moderate the discussion. So Shameen, over to you.
Thank you, Erica. Good afternoon. I'm really happy to be here discussing with you. This is a very critical time, to be honest. And right at this moment, I was discussing with Erica and some other friends. I was working on my proposal because I have a deadline today at 4 p.m. when I will have to submit for ethical approval, because I had to do some revision based on the COVID situation. So this is a very interesting time to talk to you all. So my research is, the topic of my PhD is the role of male partners in the breastfeeding practices of female ready-made garment workers in Bangladesh. So to give you a little bit of context, this is a qualitative research, and Bangladesh is a South Asian country. It is a highly populated country, and ready-made garment industry is one of the largest GDP focused industry in Bangladesh. A lot of people work in this industry, and 80% of them are women. So there are at least 4 million women work in this industry, and the payment is not very high. Most of them live in the capital city of Bangladesh, which is Dhaka, in slum areas. So they have lots of issues regarding maternal leave, getting involved with someone in personal relationship, where to stay in the slums, whether to send their kids back to home for taking care. There are lots of decisions they need to make in consultation with their family members, also based on the environmental situation in their residences as well as in the workplaces. So my plan was to go to Bangladesh and interview these female ready-made garment workers about their breastfeeding practices. And I also wanted to interview their male partners in context of Bangladesh. It is mostly the husbands, to know their understanding of the importance of breastfeeding and how do they play their role in promoting breastfeeding practices in Bangladesh. So I went to Bangladesh early 2020 to understand the context. I talked to some of them who will not be my participants in this study to understand better. And I realized that it is not very easy to interview the female garment workers based on the cultural context. They do not want to speak to a male researcher. And then we decided probably I will hire a female research assistant to interview the female ready-made garment workers, and a male interviewer to interview the partners of the female ready-made garment workers. So that was the initial plan, but I would be going there. I will be training them in the field. And after all the interviews, we'll have a discussion to see whether there are any challenges and whether we're getting the information we needed to have. So that's how I prepared my proposal in the beginning. I was planning to have around 60 interviews with the female ready-made garment workers, their partners, and others. But then COVID came up and we had to look at the proposal again. We needed to think whether this is possible for me to visit Bangladesh, because by then we already received an instruction from SGS that all international travels need to be excluded from the study design by at least up until December 30th, 2020. Then I talked to my committee members and we decided that it's not possible for me to travel and interview. Instead, the research assistant that we'll be hiring or recruiting, they'll be trained and they'll be do the interviews. So that's how I sort of revised my proposals and submitted. But then the SGS restriction extended. Now the international travels are discouraged until April 30th. And my research assistants are supposed to go to the community following all the required health protocols by Bangladesh government to interview. But then I had a discussion with the ethics board and they're discouraging any kind of face-to-face interviews. So although I'm not traveling, my research assistants are not also encouraged to go there and interview them under these circumstances. So I had to make another revision. Now, my research assistants will not be visiting the communities. They will also be conducting the interviews through phone calls only. And considering the Bangladesh context, the female ready-made garment workers or their partners and the participants are not very used to different social platforms like Zoom or Skype or other things. The only possible way to interview them will be through phone calls. And for me, it is very difficult because the time difference is 12 hours in Bangladesh and in Dhaka, and these female ready-made garment workers are very busy. They have to work from 8 a.m. in the morning to 8 p.m. in the evening, and they have only one weekend, which they need to spend with their family members and to do some side business. So it's not very easy to do that. So even my research assistants will face some difficulties to manage time. And now we are planning to get these interviews done through phone calls only. So we need to change some mechanism, how to reach them, how to give them the context, following all the consent forms and other things. So that's the stage where I am. I also needed to change some of the methodological parts. I had some interest to do focus group discussions and observational studies, but now we are not going to do that. It will be only phone calls. So I think that's my 5 minutes, but if there is any other calls, I'm happy to take them. Thank you so much for giving me the opportunity to speak to you guys.
Ellen, thanks very much. And as a member of Shamim's committee, I just want to applaud him for his perseverance and creativity and having to continually pivot in these very challenging times. James, over to you.
Hi, everybody. And thanks, Shamim, for that. That was great update on your stage of study. So my name is James White, and I'm coming from the Faculty of Nursing. I'm in entering my 5th year of the program, and mainly because the last year has been a period of revisiting and revising my strategy, I think, as Shamim has pointed out. My topic, well, first and foremost, I come from a background in nursing and international development. So my study has always been focused on sort of bridging the gap between those two fields. It's my title of my study and topic has had several iterations over the years, as Erica can attest to, but we've arrived at a broad working title related to creating a diagnostic approach to poverty assessment. So in short, what that means is that, in my 15 plus years of work overseas, working for USAID, CEDA, other international development programs in health and poverty, it's become crystal clear to me, as I'm sure it is on, to many on the call today, that many of our approaches to assisting the poor are failing to reach those that assess those who need the help the most. We're failing to measure what's truly needed, and mainly by not asking them. And we fail in our efforts to intervene. And I'm coming at it from nursing and health in terms of intervening from the consulting room or intervening through a health program. Poverty has often been the realm of economists and social epidemiologists. Multidimensional poverty is something many are familiar with, but what about in the health space? And what about in public health and nursing practice in particular? So how my study is looking at how we can challenge and maybe demonstrate a new holistic way of diagnosing and responding to poverty in the health context. Before COVID, I had done a couple of scoping literature reviews, been developing this concept. Just prior to the close of 2019, in mid-December, I defended my PhD proposal and had been about to kick off finalization and submission of my REB proposal based on discussions that I'd had with several healthcare workers, a group for nominal group technique out of St. Michael's Hospital in particular. I'd had some discussions with RNAO and Ontario College of Family Physicians about participating, all with the idea that this would be in person, several nominal group technique sessions held over several months, developing this concept. So in early 2020, I was overseas working in my professional life and had to rapidly come home with the onset of COVID, and had to step away from my study, frankly, for several months as I was professionally pulled into COVID, as my parenting during COVID took on new challenges. So I took a couple months to step back, and I think what I wanted to share today is how beneficial that was, although you don't ever necessarily want to step away completely. But in March, April, May, I had time to sit with my committee virtually, discuss what I was doing, reassess some of the key components of my study. That led to sort of revising the whole data collection approach, both to be virtual, as Shamim has described, and taking that virtual, but also reassessing who I was going to be collecting data from and for what purpose. Because I think in the COVID era, what you need to collect versus what is nice to collect becomes ever more relevant. So I was questioning what I'm collecting from who, and that's led to really totally redrafting the REB application, which is aimed now for submission end of this December. So I'm delayed by about 3 months or 4 months or more, I guess, in the REB submission. But I've done a lot of what I had planned to do in that nominal group technique with my committee. And that's the other thing I wanted to share today, is maybe utilizing our committees to fulfill a lot of our program and research effort before we take it to the data collection phase might be necessary in COVID. Really as a student, making sure you've utilized that committee to the full extent, and then looking to data collection virtually as a way to supplement that. And I think you'll hear more about people doing that today, perhaps. The last thing I'll share then is just, I've now looked at virtual formats for focus group discussions, virtual interviews, as has been already mentioned. I've totally abandoned the idea of integrating this effort into case management, which was something we were initially talking about. But given my restrictions on entering health facilities, given how busy health facility managers and providers are, really this will be focused on the theoretical development of my tool, and then demonstrating its application with a very small group of volunteers, all virtually. So I can go on and on about sort of the various thoughts and challenges that have arisen and will arise with with this, but my overall message is that in some ways this has been beneficial to take the time necessary for me to get my thinking straight on my study. So maybe I'll leave it there. Thanks.
Thanks, James. I think, we're always trying to be as intentional and ethical in the, design of research, but I guess I think you've highlighted an opportunity that COVID has provided to sort of rethink and your research focus. So thanks for those reflections. You alluded to focus groups, so that's a nice segue into what Arlinda, I think, has to share. So I'll turn that over to you now. Thank you.
Great. Thank you so much for the opportunity to be here today. So my research focuses on interventions for cancer screening with a particular interest on social media interventions. So as part of my PhD, I was hoping to conduct focus groups with individuals who are of screen eligible age, which in this case would be 50 to 74. And we were hoping to hold 6 focus groups. I was lucky enough to start this process before the COVID-19 pandemic started, and we were able to hold 3 of these in person. However, sort of at the midway point, COVID came here, everything was shut down, so we had to quickly pivot to the online format. So I just want to share some sort of key learnings I had from that experience and maybe give you something to think about if you are hoping to conduct virtual focus groups. So one of the things that I noticed was the informed consent process. So initially we had participants who would show up at a location, and while they're on site, we would get them to go through the informed consent, have them sign right there on site, as well as complete a short demographic survey. So this was no longer possible in the virtual environment. So we actually decided to email all of these materials beforehand. However, we noticed that many folks were getting, the email was quite lengthy. We were sending them a lot of information, as you can imagine. Those consent forms can be quite lengthy. So we were going back and forth a lot. So there's a lot of time that we hadn't anticipated in just getting people to fill out those informed consent forms. Additionally, it's probably also the case that some people decided not to participate or to show up at the focus group after seeing that lengthy email. That's also a possibility that maybe we don't necessarily know 100%, but I anticipate had happened. One thing we did do differently was, instead of showing up at the site, earlier to set up the room and have everything ready, we actually offered participants an opportunity to join 30 minutes earlier to check their technology and audio. So this is, I think, something you definitely want to consider, just to make sure that people are aware of how to log on. They can unmute themselves, raise the hand function, and sort of orient them to the virtual space. The other thing I noticed is that not everybody was open to turning on their cameras. So as a facilitator, you might notice that maybe you don't get the same feedback from people. You can't read the body language. You can't see, where their eyes are going, and you can't see if they're distracted or not. So that's an additional sort of challenge with conducting virtual groups. The other thing I found that was a little bit challenging was that in the physical focus groups, we had sort of images and messages that we wanted people to look at and review. So we would give them handouts. Now in the virtual space, we had to translate that somehow. So what we did is we actually translated them into PowerPoint slides. But what was difficult is that at the end of our focus group, when we asked participants to select their top, their favorite image, let's say, they couldn't just flip through their package anymore. So we had to sort of put every image up on the screen and give people, maybe 15 seconds with each image before turning the slide. So as you can imagine, that took some additional time. So we also reduced the number of images and messages that we tested as a result to account for some of these other tasks. There was also good things by going virtually. It's not all negative. One of the nice things was using functions like mute and raised hand. So participants were asked to stay on mute unless they wanted to speak, or to raise their hand if they had something to say. This helped in the transcripts because there was a lot less background noise, as you can imagine. We didn't hear, people shuffling the papers that we were handing out. as part of that transcript. So there was some nice things that came out of the virtual space. And one thing we also noticed, obviously we had some reduced cost in terms of paying for a meeting room, which before we were renting space at public libraries and paying for some snacks. So while you didn't have to do that, but maybe you need to spend more time beforehand to prepare. So in the end, maybe it's about the same cost, but that's one thing to keep in mind as well, that you don't have to rent sort of that library room or that conference space. And finally, I just want to point out that by going virtually, you were, automatically sometimes excluding certain people from being able to participate, right? So that's people who maybe don't have access to reliable internet. But for our study, it wasn't as much of an issue because we were initially interested in individuals who were Facebook users. So to some extent, these folks already had access to internet, not necessarily reliable, but they would have had access to internet to be able to go online on Facebook. So not so much of an issue for us here, but definitely something to consider about who you might be excluding as a result. So I'll leave it at that, and thank you so much.
Yeah, thank you for those great practical suggestions and some of the pros and cons of running focus groups in this context. Sarisha, I'll turn things over to you about your experience.
Thanks, Erica. And hi, everyone. Really happy to be here today to share with you some of my experiences with data collection. So just to give you a bit of context, my PhD focuses on gender-based violence policy implementation in Guyana, which is a South American country. And I mainly wanted to focus on this to understand why certain policies were seemingly being implemented in an inadequate way, because the rate of violence against women is quite high in the country as compared to other Latin American and Caribbean countries. So my focus is to understand how key policy actors in relevant sectors, such as law enforcement, the judicial sector, health, advocacy, and social services, how these policy actors actually implement gender-based violence policies. And I decided to do a case study and focus on the capital city, which was Georgetown. So when the first wave of the pandemic hit, I was actually in the process of developing my research proposal. And so I had a plan A, which was to conduct both focus groups and interviews in person. Now, I spoke with my committee and decided to include also a plan B in my proposal, which was just to conduct virtual interviews. And so based on my previous experience, so I had done some research in the past in Guyana just last year in regards to gender-based violence research. And so I was pretty familiar with the context, and I understood, some of the technological capabilities for the general population, and understood the process of recruitment as well. So I knew that in the past, like in-person recruitment was the best way to go, but I knew with the new context, of course, I wasn't able to do that. So I had to pivot that piece of my data collection process. So I took a two-pronged approach. I had to email some national officials to gain permission to actually recruit participants in certain sectors. So for example, I had to email or approach the commissioner of police in order to interview police officers. So I went ahead with emailing a formal letter to these national representatives, but I also hired a research assistant who's in country, who I had worked with in the past. And she actually followed up by phone, and usually did this a few days later after I had sent my letter. And sometimes, she would get through. Sometimes it would take her a few times to get through to who it is that I was emailing. But this really helped with gaining permission. And once we gained permission, we also asked these national representatives to help with recruitment. So distribute a recruitment letter on my behalf to frontline policy implementers as well as regional representatives. And using this process, I found was very helpful with recruiting individuals. And my research assistant helped with scheduling, so determining best times for both of us to meet, myself and the participant, and also to figure out technology. So most people decided to use their phone for these Zoom calls. So we wanted to make sure that they had access to Wi-Fi, just so that they wouldn't use their data plans and of course use up their own money. So in terms of the interviews, I made sure that those folks who didn't have access to Wi-Fi, reliable Wi-Fi, we actually purchased data for them so that they could, so that they wouldn't have to spend their own money, of course. I also decided to send, well, I decided to have a verbal consent form because, you know, as Arlinda mentioned, you know, I knew it would be difficult to get people to fill out the forms, you know, print out the forms, fill them out, scan them, send them back. And so I decided to go forward with a verbal consent form and a short demographic survey, which I emailed to all participants, but they weren't required to look at it. They were able to if they wanted to. I also informed participants through my interview assistant that the interviews would last about 2 hours or less. And but I would try to keep the interviews to about 90 minutes because a lot of participants were doing this during work hours. And I also requested that participants be able to use the video on their phone because I really wanted to try to recreate a real interview situation. Because as Arlinda mentioned, you know, it's really important to see body language, to see expressions, but also to just develop a rapport with the participants so that they feel comfortable speaking with you. And because I'm focusing on gender-based violence, violence against women, it is a sensitive topic. So I wanted people to feel as comfortable as possible. So I found through the process, I just completed my data collection. I almost completed my data collection. I have one more or a couple more to go. But I found out that most people didn't have major technical difficulties. There were a few times when I had to reschedule with some participants. In one case, I found out that I had to turn off the video over Zoom because it was taking up too much bandwidth and the video kept on freezing. So that was something that I just had to figure out as I went through the interview process. And in terms of the way that I conducted my interviews, I started off by going through the verbal consent form and highlighting some of the key points. And I signed these verbal consent forms on the participants' behalf. So I asked for their permission to sign on their behalf. They gave it to me, and that's how I went through the consent process. I also completed the demographic forms on their behalf. So I read out the questions to them and they answered. And once I finished filling out both of those forms, I started the interview, and that's when I would start the recording over Zoom. I also found it helpful, of course, to have a notepad beside me to take notes about the conversation, of course, body language, any expressions, hesitation, and any thoughts to come back to later on. So that's the interview process for me in a nutshell. I'm happy to answer any other questions later on.
That's great, thanks. There's lots of rich examples in what you shared, including, you know, the need to work through gatekeepers to even access your key informants and how your RA helped with that, and also how to mitigate some of the, you know, resource challenges that people may face to even participate. Thank you for that. And last but not least, Allison, over to you.
Hi, everyone. Thanks so much for joining today and for inviting me to speak. I'm really excited to have a discussion after this. So I guess just to kind of introduce everyone to what my area of research has been on and what our approach was. I spent the last 4 years working on a cluster randomized trial at a nutritional rehabilitation unit, which is an inpatient ward for children with severe malnutrition and medical complications based in Blantyre, Malawi. So essentially, we conducted a futility analysis due to low recruitment to our trial, which actually coincided with the onset of the COVID-19 pandemic. So in our trial, we were testing the effectiveness of a counseling program for mothers of children with severe malnutrition. The program was led by nurses who worked at this inpatient ward, and it involved a few different modules covering nutrition, WASH, as well as responsive parenting. And we were interested in seeing if it had an effect on child development 6 months after children left hospital. So again, we evaluated this in a cluster randomized trial in which mothers and children were recruited at the start of each week, and the week was randomized to the intervention or comparison arm. So we experienced some major challenges in recruitment due to a substantial decline in admissions. So it equated to about a 70% drop over the last decade at this particular site when I looked closely at the data. And this also reflected what was happening across the country. So I partnered with the Ministry of Health to look at data over the last 10 years across Malawi for severe acute malnutrition admissions, and there has been a major decline. So essentially, our recruitment was about a quarter of what we expected. And unfortunately, this study population has quite a high mortality rate. So this made it quite difficult to recruit patients and follow up patients that did survive. So essentially, after about 3.5 years of recruiting and only reaching a third of our sample size, our team decided to partner with a statistician at SickKids named Dr. Anna Heath to do this futility analysis. So essentially, this is an analysis done to determine if there's a trend towards a positive result of a trial based on a simulation of existing trial data. So if the probability of this positive result is below a certain threshold that's decided on before the futility analysis, then you stop the trial. Otherwise, you continue the trial until you reach the expected sample size. So using all the follow-up data that we collected in the first 3.5 years, we found that there is just an 18% chance of seeing a positive result, meaning an effect on child development if we continue the trial. This was below the threshold that we decided upon beforehand of 20%. So we made the decision to stop the trial, and coincidentally at the same time ended up having to halt data collection because of the COVID pandemic. So we did this futility analysis at the end of March, just by pure coincidence. I do want to note there are several limitations of a futility analysis, such as having a smaller sample size and therefore being underpowered to do additional secondary analyses. It also introduces a source of bias, which can affect any future meta-analyses using these data. However, I do think there's really a lot of potential for adaptive trial designs with interim analyses like this one. It should be considered for global health trials, especially during the pandemic, when you really want to minimize putting participants and staff at any unnecessary risk. I also believe that it's important to include implementation outcomes as well as qualitative work to assist with interpretation, especially in the case that a trial is stopped on the basis of futility like ours was. So with that, I think I'll pass it back to Alyssa and Erica, and I'm excited to discuss this with all of you.
That's great. Thanks very much, Allison. I think it's a great example of, your research designs are never static, right? What you propose to do, you need to adapt regardless, and COVID presented another opportunity. Alyssa, over to you.
Perfect. Thank you. And thanks all of you for presenting this. I've taken so many notes. This is so phenomenal. I love this. And hopefully everyone who's joined us feels the same way. So now we will turn it over, give everyone a chance just to ask any questions or make any comments. You can either use, if you want to come off mute, you can use the raise hand function and we'll keep track of that. Or you can type your comments out in the chat. And maybe while we wait for some people to type those out, I have a few questions. I don't even know where to start. So I think one of the questions, and Linda, I'm going to like put you on the spot a little bit. I'm sorry, but anyone could work with this too. So you had your focus groups, or you had a plan to do 6 focus groups. You were able to do 3 of them in person, and then the other 3 you switched to online. I'm wondering, in that process, did you consider like not doing those remaining 3 and doing individual interviews, or doing another approach, or just completely scrapping it and only using the first 3? Like, can you tell us a bit more about your thought process behind all of that?
Sure, and I actually did not consider not doing them, and the reason for that was because the first 3, we had one mixed sex, one female and one male focus group, and to stop data collection after one focus group with each of those different groups, I think would have been not enough to proceed. But also keeping in mind how much investment we already had put into that study, right? So 3 focus groups, while it doesn't sound like a lot, when you start to think about the resources and the amount of time that you put into that study, that's a big investment. So we definitely didn't think about stopping. But I think when we talk about the results, there will be some nuanced discussion around sort of the switch between the in-person versus the virtual focus groups.
Perfect, thank you. And there are some questions coming in the chat. So James had a question about compensation. So we asked, to colleagues who have shifted recruitment to virtual, have they adapted their compensation? Sorry, Linda, you mentioned that the change from lunch provided, but what are people's thoughts on compensating online data collection participants? And I know that this was also brought up around where, yeah, I'm curious, like even broader, to hear from people about their budgets. And like now, if you're not doing any international traveling, you might have some extra money, but then you'll still be hiring people on the ground. So how have your kind of budgets shifted overall? Anyone who wants to take that?
So I can take that, or just share my experience. I initially wanted to provide compensation to both focus group and interview participants, but because everything shifted, my thought process was, because I was focusing on professionals who were typically using their time at work to participate in interviews, I decided not to then compensate those individuals. And so I was able to use that funding to hire a research assistant. But what I did save some of the funding for was to ensure that I could purchase data for people to participate. So that was my thought process, but just wanted to share that in the past, when I had done gender-based violence related research, when I was working with survivors, I always made sure that I provided some sort of compensation, because a lot of the time they were taking up their own personal hours to participate.
And if I can add to the compensation, we did still compensate participants the same amount for in-person versus virtual, because we felt that they're still spending, in some cases, maybe even more time in sorting out our emails beforehand and the technology in this particular target population. So we still paid them the same regardless if it was virtual versus in person.
Excellent, thank you. And James added a comment that he's also considering data and/or supermarket gift certificates. I feel like gift cards is a popular thing that people are spending money on these days. Another question is for those conducting virtual interviews, wondering if you've come across any unique strategies to develop trust with the participants, given the barriers with virtual communication that you've alluded to. So I feel like we're putting Arlinda and Sarisha back on the spot.
So some of the things that I found that were useful was through email communication. So being able to directly connect with those participants who had questions over email, I was able to develop a bit of a rapport. I think also working with a research assistant who I had worked with in the past, who also had a very approachable nature. So, you know, she was willing to work with all of these individuals to figure out their technical difficulties if they had any. I found her to be very helpful. Now, one thing that I noticed, especially working in a country like Guyana, there's a lot of diversity. People are very curious as to why you're doing research, who you are. You're not from the country. And so I found that, you know, when I started off some of the interviews before I started recording, I would just share a little bit about why I'm doing the research that I'm doing. And it gave the participants the opportunity to ask questions. Of course, some participants asked questions about the consent form when I went through that with them, but they also asked some personal questions. So where are you from? What are you why are you studying this? What's your interest? What's your background? I got a lot of questions about my background. And so, you know, I really had to decide as to how much I wanted to share with people. And think about what would also make them comfortable with sharing things about themselves. So, you know, I decided that in advance, and because of the previous experience that I had in the country, I knew that those questions would come up. So I decided where my line was in terms of the line that I didn't want to cross in terms of sharing too much about myself. So I found that really opened up the conversation a lot, and people felt a little bit more comfortable to share with me.
And if I can add, in the focus group, similar to the in-person, when we went virtual, we had held an icebreaker at the beginning, so giving people an opportunity to share a little bit about themselves. And before we started any recording, we also let participants know that they were free to use a pseudonym or some other name, and we gave them a moment to change that on their Zoom if they hadn't already. And I think doing some of these things before sort of the formal focus group started was a good way to kind of start to build a little bit of that trust and hopefully open up sort of the lines of communication.
Perfect, thank you. Those are really great tips from both of you. Arlinda, I have one more question for you, and then we're going to give you a break. So the question is around your focus groups and the difference between the virtual ones and the in-person ones. So did you, I don't know where you're at, like if you had a chance to really analyze and compare and contrast, but wondering if there are differences between in the content and dialogue between the participants.
So I would say some of the content, as I mentioned earlier, that we had to pare down, but that was also the case for the in-person ones, because some groups seem to be chattier than other groups. And so there were cases in both the in-person focus groups where we didn't actually get through all the material that we had planned for that session. And in the virtual space, we also reduced the number of messages and images we were going through as a result, and in anticipation of, you know, technology maybe taking up more time than we would have liked. There were some differences, obviously, in the flow of the focus group I found, because as you can imagine, with the online virtual space, we had asked people to raise their hands. So obviously there's not the same kind of flow sometimes to the conversation when somebody says something and the other person immediately jumps right in to agree or disagree maybe with their comment. So there was a little bit of that, but in hindsight, that wasn't a bad thing when you're going through the analysis, because then the transcription is a little bit cleaner. As I mentioned, there's less background noise, less interruption, which can help you sort of make sure that you capture everything that was said.
Perfect, thank you. So I'm wondering for any of our panelists, how have your study partners responded to the COVID pandemic? And have you found that they're still as engaged as they were previously, or maybe naturally COVID is distracting them and drawing them to other priorities. How have you found that your collaborations have changed, if they have?
Excuse me, probably I can share briefly. So I have a community partner in Bangladesh who have been working with female ready-made garment workers for a long time, and they have been conducting both qualitative and quantitative researches. So they're our focus point to entry into the community. It's not very easy for me or others to get into a slum without having proper rapport. So this community organization and their chairperson, they have been working with the community people, and they are well aware of their particular works in the communities. So we have been in touch with them, and they have faced a lot of challenges as well for this COVID-19. So when we discussed with them about the possibility of pivoting our research design from in-person interviews to telephone interviews, they have been very supportive, to be honest, because without their support, it would be very difficult for us to recruit research assistants as well as convincing the community people about the changes. So they face the challenges. That's why they know how to proceed with the changes. And we had a lot of discussion how this can be done, because although they will give us the access to the community, they will not take a lead, because this is an independent research. So they probably will just introduce me or my research assistants in the community. And now introducing us through phone calls will be a bit difficult, but they have stepped into this research because they know how important this is. They have been working with the female ready-made garments worker for more than 20, 30 years, and they know the role of male partners or others in the community in promoting breastfeeding has not been explored yet. So they're very supportive, and they discuss with us about different challenges. And we sort of identified what needs to be done at this current situation, how phone calls can be made, and how the participants may be responsive to discuss with us different things.
Yeah, I can add a little bit to that. I think, you know, what's being described are these gatekeepers that for health and public health studies you absolutely need. And so whether it's overseas or my studies now focusing on downtown Toronto, you know, Inner City Health Associates, St. Michael's Hospital, RNAO, these organizations were and remain completely slammed with COVID-19 itself. So I think, you know, what Shamim described is understanding their needs and priorities and restrictions, and then fitting this PhD study, which is what it is, into a realistic situation. But for my partners, they've been very responsive, but response time went from 24 hours to, you know, 3 weeks. So I think just keeping in mind that a lot of these gatekeepers are probably still very motivated, but now have a plethora of other challenges that they're dealing with.
Absolutely. Sorry. Thank you. And James, I want to touch on some of the points that you made during your when you were talking about how you took this opportunity for a pause to really take time to chat with your committee members and reflect and really be deliberate about your next steps. And I don't know you, but I get the sense that you're doing this kind of part-time, like there's a bit of flexibility with your PhD schedule. So I'm wondering, for everyone else on the panel, how have your kind of timelines changed, if they have? Have you had that opportunity to take a pause? Did you want to use it? Did you not have one? Tell us a bit about that.
Well, first I'll clarify. I mean, I think had it not been for COVID-19, I probably would have forged ahead with the initial plan. I think having had the time, sort of the mandated COVID-19 mandated time to reflect, it's just led to a better study. So whether it's as part of your ongoing PhD development, or whether it's because you've had to reassess and sort of shift or focus differently, I think it's helpful to ask some fundamental questions, not just how will I adapt my PhD to COVID, but in the new COVID context, is my PhD topic still completely relevant? I mean, I'm looking at poverty. So I had to ask myself fundamentally, are the questions I've been asking myself still true? And then make revisions to the study plan based on that. So I think whether it's someone, and I am relatively part-time, although nursing would disagree, and it wants me to graduate very soon. But I think, this is part of what I've learned is an ongoing process as a PhD student. It's just constantly revising and questioning yourself, and COVID-19's been a chance to do that. But over to others, I don't know if they're feeling the same.
Yes, so that's an interesting perspective, James. I also think I had some opportunity to reflect on my understanding of my PhD research and how this can be made more fruitful and effective based on the interests of the community people. But on the other hand, as a full-time PhD student, I think I have suffered due to COVID-19 because I had an initial plan to collect my data during last summer and probably start analyzing by now. I have a 5-year funding and I'm at the end of 4th year. So I think my PhD is going to be affected and it will take at least 6 months to 1 year extension, which is very difficult for a full-time PhD student. So it's been challenging, although I had to manage, and I'm really happy that I have been in touch with my committee member and proposed several changes which might increase the quality of the PhD thesis. But on the other hand, I have challenges. I'm always constantly thinking about how to manage this. I mean, if it goes beyond the funding span, then how to manage this PhD work and other things. So it's been a challenging time for me and many of my colleagues whom I have spoken to who are doing their PhD in an advanced level.
I'm glad you raised the finance issue. It's not something I mentioned, but I'm not funded. I'm still a full-time student. I'm not funded as such. My employer has helped because they know that COVID has ruined a lot of plans. So yes, extending and taking this time to reflect has come with financial implications. But in my case, it was something I could manage, and my employer helped out. But yeah, for these 4-year funded cohorts, years 5 and 6 are on you. So I think that's worth noting. Yeah.
And I just want to make a quick comment. While COVID didn't, delay this particular study of my work by very much, we were able to run the virtual focus groups within 2 months or so since March. What it did change is actually my third study, which was to be testing these messages in an RCT. And because the cancer screening programs are no longer operating in the same way as they were prior to, I've had to rethink sort of what my third study would be for my PhD, and also think about my program of research and how I can maybe use some of the foundational work and the research protocol I've developed already as part of a postdoc or sort of that next step in your research career.
Thank you for sharing that, Erland. I think that's a really good point around just prioritizing and looking at like what is actually realistic and feasible right now, and what can happen later in your career as a researcher. You're going to be a researcher for a while, so you don't have to finish everything right now.
Sorry, Alyssa. Allison, did you want to jump in?
Oh, sorry.
No, I just I saw on the other end of my screen, so I wasn't sure.
Sure. Yeah. I also just wanted to comment on how I think that this has been a really good opportunity for our research team, at least. So I work with a team of about 15 people in Malawi who are data scientists, enumerators, and so on, a lot of which are junior researchers. So this has been a really good opportunity to actually be able to pause and look at all the data that we've collected and share that data amongst all of our team members. And they've been able to come up with their own research questions and learn different analysis methods during this time while they're not focused on collecting the data. So I think there are a lot of other opportunities, especially when you've had ongoing research, and a lot of the data, unfortunately, does end up being unused unless there are opportunities like this.
And if I could just add, when the first wave of the pandemic hit, I actually was really worried, and I was thinking about shifting my topic to focus not on Guyana, but on Canada, because of course we're seeing increased rates of violence against women due to, restrictions, stay at home, lockdown, etc. And after speaking with my committee, I decided to move forward with collecting data in Guyana. And I really think that, I'd put a lot of work into developing, of course, going through the qualifying exam, developing my proposal. And so my committee members really helped me to make that decision. And I found that actually moving forward with my data collection, I found that it seemed to have sped things up a little bit for me because I'm a part-time student, working full-time. And so being able to conduct interviews virtually, I didn't have to travel and spend a lot of time in country. So I felt that it really sped up the process for me, which is very different than the other folks on the panel.
If I could add to that, I think this will speed it up for me. So I think you're exactly right. That extra time with my committee, thinking things through. Now the questionnaires are more developed. Everything's just, I think, more, I think others have described as intentional. So I agree. I think overall, this might even speed things up. Yeah, thanks for mentioning that.
That's fantastic. I'm very glad that people are having a relatively positive experience in such a wild, strange time. And it seems like people are adapting quite well and just being flexible and open. So that's fantastic. And I know we're almost at time, so I just want to give a moment for if there's any final questions or comments from the audience or from the panelists, please go ahead. Okay, well, so in that case, I think we'll wrap it up there, but thank you all so much for joining. I hope that everyone listening in was able to gain a lot from this conversation. And I hope that our panelists as well, you're able to learn from each other, and maybe you'll meet up with each other and discuss all of your learnings together. And I just want to share with everyone that we have made a list of resources. So if anyone has anything that they'd like to add to that, the resources are specific to kind of pivoting your research in COVID times. So either making research design changes or changing your from virtual or from in-person to virtual interviews. So if you have any resources to share, please, you can either put them in the chat or you can send us an email. And we will compile all of our resources into a nice tidy sheet that will be emailed out to everyone at the email address that you registered for this with. So thank you all again for joining, and I hope that you enjoy the rest of your Tuesday. It's Tuesday, right?
And thanks so much, Alyssa, for facilitating this discussion. Thanks to all of you.
Thank you for having me.
Great. Oh, great job. Thanks. Bye, everyone.
Thank you.
Thanks so much.
Thank you.